So yesterday's session, I provided I went over letter A and letter B with you, and I went over the key terms for C, D, and E. So now tonight I'm going to go over the codes for C, D, and E, and then we're going to go on to the next assignment within this Connect question or Connect homework 1, assignment 1 rather. Okay, so we have find a code up here. I'm signed in, and our code says find the following codes in the index of CPT, enter the key term you use to find the code. I explained the difference between, I always like to maneuver between the alphabetic index, especially using an online resource. So if you have find a code, I always like to toggle between the find a search and also the Clickadex. Okay, so in this case, I'm going to go ahead and since we're just locating the codes, I'm just going to go ahead and copy and paste X-ray of duodenum into my search engine here. And for the left-hand side, I'm going to make sure the CPT is the only one checked. I'm even going to unselect modifiers and HCPC and close that. So we have 3 complete matches and the rest are partial matches. So let's go ahead and just open all of these up, okay? Like I said, clicking on all of these links will do wonders. Oh, no problem, Tisha. Glad you can join us. Okay, I'm just beginning actually. So I'm going over the week 4 assignment. I believe it's the assignment 1. Yes, the first question. Okay, and then I'm going to go over another question within this assignment 1 as well too. So we're just getting started. You're just in time actually. Oh, good. I'm glad to hear that. Awesome, awesome. And also, when you get a chance, be sure to listen to last night's session as well too. That went over the 2 assignments in Moodle Rooms. Okay. All right. Excellent, excellent. All right, so we have X-ray of duodenum, and I was telling everyone that you have 3 complete matches and the remaining partial matches. So I brought up the first 3 matches here, the first 3 complete matches, and we can go through each one to rule out any necessary ones, okay? So we're going to start off first with 74241. This says the radiologic examination, gastrointestinal tract, upper, with or without delayed images with KUB, okay? We next have radiologic examination, gastrointestinal tract, upper, with or without delayed images without KUB. So this is with and this is without KUB. So therefore, okay, let's go ahead and go to this one because again, our assignment just says X-ray of duodenum. Okay, all right. So again, no radiologic examination, gastrointestinal tract, upper, with or without. That's too detailed. And in this case, from what our assignment, remember, it's documented. This is what we code for. This is documented only X-ray of duodenum. Period. That's it. Okay. So these 2 are too detailed. Let's go ahead and go. Okay. Duodenography, hypotonic. This is it. That's pretty much AKA for X-ray of duodenum. Duodenography. Try saying that more than once. It's like a tongue twister. Okay. But duodenography. Okay. You know that's X-ray of the duodenum. So therefore, this is our correct code 74260, and that's going to be entered into that slot. Now remember, the codes and key terms for A and B are in last night's session, as well as the key terms for C, D, and E are also in last night's session. So therefore, I'm just going with the codes for C, D, and E for this evening's session. Okay. All right. Next, we have unlisted procedure, maxillofacial prosthetics. Okay. Let's go ahead and clear our tab search here. All right. Copy and paste unlisted procedure, maxillofacial prosthetics. Oh, Thomas, the key term just means the main term pretty much. So that's just the key term is just your main term, the actual procedure, what type of procedure, what kind of test, what procedure of the duodenum. So that's what that is. Like I said, last night's session, go ahead and listen to that, and that explains more in detail on how to, that key term, okay? All right, so we have unlisted procedure. Oh, you're welcome, not a problem. So we have our unlisted procedure, maxillofacial prosthetics, and we have 1 complete match. So let's go ahead and click it here and select it, unlisted maxillofacial prosthetic procedure. That looks good to me. Let's go ahead and just for the kicks of it, let's go ahead and click on the 1 partial matches. unlisted craniofacial, and no, it doesn't specify any unlisted craniofacial and maxillofacial. It just says plain old maxillofacial procedure, unlisted procedure. Okay. So again, only one complete match. We looked, and it's unlisted maxillofacial prosthetic procedure. Again, unlisted procedure, maxillofacial prosthetics. This is our correct code, 21089. Okay. Next, we have DTaP immunization. Okay. DTaP immunization. Let's go ahead and close out of that. Okay. So here we have several complete matches. Okay. Several complete matches. And this is a bit tricky. Let's go ahead and click on our first choice here. Now, this one says diphtheria, tetanus toxoides, and acellular pertussis vaccine, or DTaP, would administer to individuals younger than 7 years. Did it specify anything about what the patient's age is? No. So we know that's automatically ruled out. Okay, again, that's automatically ruled out because it did not specify DTaP immunization for anyone under 7 years of age. Okay, so that's ruled out. Again, it's always important to click on each selection. Okay, so we know this one's ruled out. Okay, and this one is just a general section. It provides you everything, a whole list. So let's go into the other five first before we go into that. So let's go into the next one. 90698. Okay, we know this is not right because the code was changed in January of this year. So this is automatically ruled out. The code was changed completely in January of this year. So this is automatically ruled out. That's why it's very, 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 very important to read everything underneath this code information. Everything under this code information. Okay. So again, this code was changed January of this year. So therefore that's ruled out. Okay, next we have 90701. Warning, code deleted January of 2013. So this was deleted 2013. So that's automatically ruled out. Okay, now let's go to 90720. Deleted January of this year. Okay, let's go to the next one. Deleted, wow, these are all deleted. January of this year, they're deleted. Okay, so we have one option left. Let's go ahead. All right, so DTaP or Hep B or IPV for intramuscular use, the DTaP. So this is our correct code, 90723. Okay, so again, it's very, 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 very important to click on each code and rule out what belongs and what does not belong. Okay, and so since this is so general, just a plain DTaP immunization didn't specify what type or what vaccination or immunization along with it. It just specifies, just says DTaP immunization. Doesn't even provide anyone's specific age or anything. Okay, so therefore that means, and all these other codes were deleted and changed, and this specifies the age, which this does not. So therefore, our only option, 90723. Okay. So going on to our next assignment for this evening. And let's see, I believe it is, not sure if it's, okay, yep, number 3, this one right here. All right. So we have 3 cases, and it says to use the office visit evaluation and management codes, which is CPT, that's procedural, or it is usually provided during evaluation management. Which code would you select for each of these cases? So therefore we have case A. Now, case A is a chart note for established patient. Okay, so we have the patient returns for removal of stitches I placed about 7 days ago. Reports normal itching around the wound area, but no pain or swelling. So again, and again, you might say, Ms. Rogers is so detailed, she's so specific, but I need to read things more than once. That's how I am. I need to read things probably 2 or 3 times. So again, the patient returning for removal of stitches. 7 days ago, they placed the stitches, so the patient wants to have them removed. The person reports normal itching around the wound area, which is normal for, stitches, but no pain or swelling. Okay, which is that's pretty good. Okay, that's not a maximum severity. or high severity case. So therefore, the wound at lateral aspect of the left eye looks well healed. The decision was made to remove the 5x0 nylon sutures, which was done without difficulty. Laceration healed. Patient advised to use vitamin E for scar prophylaxis, and they're good to go. They can leave, okay? So this is an office outpatient, okay, established patient. Okay, so of course, because this patient was in the office, so I always type in, let's see, office, outpatient, established. Office, outpatient, established patient. Okay, so we have several complete matches. Before I go into these responses, because it just brings you into several different ones, I'm going to go ahead and click on the actual code, or, select these. Let's look in these selections first, okay, these codes. So let's go ahead and select this one. I always like to bring up a few of them so I can just, okay, all right. So the first one we brought up was 99211. Now let's look at this one. Now we're comparing to this one. Okay, so we have office or other outpatient visit for the evaluation and management of an established patient. That looks correct, right? Okay, but we have to read on. That may not require the presence of a physician or other qualified healthcare professional. Usually the presenting problems are minimal. Typically 5 minutes are spent performing a supervisory services. Now this one looks, it's too simple, rather, okay? Now, yes, granted, this one, looks like the patient was in and out. That's true, but it definitely took longer than 5 minutes. And then second of all, in looking at this code, it says it may not require the presence of a physician or other qualified healthcare professional. Yes, it does, because why? Because this assignment specifically says wound at lateral aspect of the left eye looks well healed. Decision was made to remove the sutures, was done without difficulty. Laceration healed, patient advised. Okay, so this was an actual evaluation, actual management, actual office visit to remove stitches from a procedure that was done. So this does require that patient's physician or a qualified healthcare professional to complete the task for today's visit. So therefore, this is going to be ruled out because this visit requires the presence of a physician or other qualified healthcare professional. Okay, so let's go ahead and go to 99212. Now let's read over that. Office or other outpatient visit for eval and management of established patient. That looks good, which requires at least 2 of three components: a problem-focused history, okay, problem-focused examination, straightforward medical decision-making, which it was, counseling under coordination of care with other physicians, other qualified healthcare professionals or agencies are provided, consistent with the nature of the problem and the patient's and or family's needs. Usually the presenting problem are self-limited or minor. So in this case, it is minor. It's not self-limited, kind of like the other code where it doesn't even require a physician. Okay, it is minor, but typically 10 minutes. So basically they're saying typically 10 minutes. So basically, at the least 10 minutes are spent face-to-face with the patient and their family. Okay, so this one looks promising. Let's go ahead and go to 99213. Okay, so this says the same thing: established patient, expanded problem-focused history. No, it is not. It's not an expanded problem-focused history or exam of low complexity, low to moderate. No, it's not. It's not such a moderate case. Okay, and it wasn't an expanded problem-focused history and examination. Okay, so therefore we know that's ruled out. Now we can say 99214, 99215. That's going to be for a longer period of time as well, or a higher severity. Yep, see, moderate to high severity. Moderate to high severity, excuse me. So we know those are ruled out. So therefore, in this case, the closest one matching is this one that's self-limited or minor, and it's a problem-focused history, problem-focused examination, straightforward medical decision-making, and that's it. Counseling and/or coordination of care, and that's all that's all that's needed. Okay. So in this case, at 99212, whoops, put too many digits here, is going to be our correct code for this specific chart note. Okay. Now moving on to case B, we have an initial office evaluation by an oncologist. So I don't know if you all picked up on that, but the first few words that out of my mouth was initial office eval by oncologist. So initial means what? New. the initial response, initial posting, initial office visit. Initial is the very first visit. So this patient is new patient of a 65-year-old female with sudden and unexplained 20-pound weight loss. Comprehensive history and examination performed with medical decision making of high complexity. So our key terms are, okay, we got a new patient. Okay, of course, it's an office, outpatient. And of course, the medical decision making this is a high case, high complexity. So let's go ahead and click on or click out of that. Let's go ahead and click on, I could have left office outpatient. So our office outpatient, this time I put new patient. Okay, and again, let's go ahead and differentiate and try to roll out these actual codes here. Okay, so I'm going to go ahead and just click on all of them. Okay. Okay, now the first one I clicked on was 99201. Okay, office of the outpatient eval and new patient, that looks correct. Okay, problem focused history, problem focused examination, straightforward medical decision making, counseling coordination. The presenting problem are self-limited or minor. Nope, because we want high complexity. Okay, so this is automatic out. 99202. Okay, new patient, expanded, low to moderate, nope, ruled out. Again, we want high complexity. Okay, office, new patient, yep, detailed, low complexity, nope, moderate, nope, we want high. 99204, office, new patient, yep, okay, moderate to high severity, we don't even want moderate, this is high complexity, it specifies this is a high complex case. So therefore, this is ruled out because it does specify it's medical decision making of moderate complexity. This one specifies medical decision making of high complexity. So therefore, this is ruled out. So we have one last code left from the actual matches we have in Find a Code. We have office. Yep. Okay, comprehensive. All right. Again, what do we have here? Comprehensive. Yep, comprehensive history and exam. Okay. Yep, exam. All right. High complexity. There we go. This is our code. Okay, medical decision making of high complexity. This is our correct code, 99205. Okay, and then our last one for this evening, we have case C. Now, again, this is an office visit by established patient, keyword established patient. Patient's been there before, for a regularly scheduled blood test to monitor long-term effects of Coumadin. Nurse spends 5 minutes. Again, it specifies they spent 5 minutes. So that just lets you know, okay, maybe that's somewhere in the code as well. So established patient, nurse spends 5 minutes, reviews the test, confirms the patient is feeling well, and after speaking with the physician on the medication, states that no change in the dosage is necessary. Okay. So therefore, let's go ahead, let's close that out, and let's start with office, outpatient, again, okay, and this is an established patient, okay, kind of like our first case, okay, all right. So, again, we have 5 of them here. What do you see here? So I'm going to let you guess. So seeing from this, remember what I pointed out? From these codes, do you see the code here placed already just from looking at this page? Remember, we have office, established. Nope, you're close. Not quite. Okay, I'm sorry. Wait, I'm sorry. Go ahead. Let me. Oh, that popped. Yes, 9. Okay, I saw that. I'm sorry. Okay, 99211 is correct. Yes. My mistake, everyone. Yep, I just saw the 9921 popped up. Okay, yes, that is correct, 99211. And why is it 99211? It specifies right on the first page, incomplete matches, 5 minutes. Okay, 5 minutes was spent. Okay, so therefore, this particular code matches, oops, I already had it up, office, eval and management, again, may not require the presence of a physician or other qualified healthcare professional. What did our assignment say? After consulting with the physician on the meds. That means the physician didn't even have to come in the office. Okay, the nurse went outside, out of the room, told the patient they'll be right back, consulted with the physician, came right back in. There you go. No need to see the doctor. You can go pay at the desk and set up your next appointment if necessary. Okay. Again, 5 minutes was specified. All right, so that is correct, 99211. Okay. Oh, no, it's okay, Carly. No problem. No problem. Your response was the one that popped up first for some reason, and that's what I saw. So my apologies. But yes, no, I understand exactly what you meant. So that's exactly how we find that particular code. But that great job. Great job. Okay, so 99211 was our correct answer for that one. Okay, and that's how that's located or found. Okay. I see others typing here. I see Thomas and Megan type. Oh, you're welcome. Oh, good, good, good. I'm glad to hear that, Tom. It's great. That's wonderful. I'm very, 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 very glad to hear that. So that's great. No, you know what, Megan? It's not possible that it's wrong. That just means that the McGraw-Hill system was not updated on that particular one because that's not current. Okay, so therefore, when you type in that answer, again, remember that I always go in manually and correct them. Okay, you're welcome. Not a problem at all. Okay, so again, remember, you're looking at the actual code resources like Find a Code. If you had an actual code manual, you would see that code or that 90721 or other codes, aside from 90723 would not, they're not even existing because they were either deleted or changed. Okay, so we're going off the current software. Okay. But yeah, I always go in and override anything that that the system spits out as incorrect, but it actually is. Okay, so no worries. Oh, you're very welcome. You're very welcome, both of you. Yes, not a problem. Okay, not a problem. And you know what? Let me go ahead and show you something really quick. I'm not sure. You know what? If you guys can sit tight for just 2 more minutes, I just want to at least begin this question for you. Just give you a little hint. I'll finish it up tomorrow, but I just want to give you a little hint with this one. Be sure, remember this says rank the following codes in order from highest to lowest reimbursement level. Okay, so therefore we have to rank them. So what would be the highest code level? You're gonna go ahead and check your ebook and resources. Click on your learning outcome. Okay, because this will help you tremendously on what to code from the highest reimbursement. Basically, the most important procedure. Okay, so I just want to go. Okay, we're gonna scroll to see where these modifiers are at 51, 59, and 53 for this specific code. Okay, so let's go ahead. Okay, so there's 50. We have 50. Okay, so here's 51. Okay, so this is multiple procedures. It's used to identify a second procedure or multiple procedures during the same operation. The additional procedures are the same type and done to the same body system. So, for example, to report 2 procedures, a bunionectomy on the great toe and in the same session, correction of a hammer toe on the 4th toe. So this is just multiple procedures during the same operation. Okay, 2 procedures done during the same operation. Okay, let's go to 50. Okay, let's go to 53. A discontinued procedure is when the procedure is not even performed or discontinued due to circumstances that threaten the patient's well-being. For example, surgery discontinued because the patient went into shock during the operation. So it couldn't even proceed. They couldn't even proceed, during the operation. They couldn't finish their job, their task at all. Okay, so therefore, this procedure was discontinued. It didn't occur. It didn't occur. Okay, couldn't resume. Now we have 59, a distinct procedural service. This is used for a different encounter or procedure for the same patient on the same day. a different patient encounter, an unrelated procedure, or different body site or system, or a separate incision or injury must be involved. Okay, so again, this is used for a different encounter or procedure for the same patient on the same day. So this one is distinct. This key word distinct means that this is the most important. Again, this is more the distinct procedure, different encounter or procedure for the same patient on the same day. Okay, so again, this is the distinct procedural service. This is going to have the highest reimbursement. Okay, which is AKA, it's a distinct, basically a separate procedure. So they basically had separate procedures on the same patient on the same day. So therefore, we have 59. And of course, you could put separate or distinct, service. Okay, distinct procedure. Okay, and then so the middle reimbursement, we have, let me see. Okay, let me go back here. All right, so we have 51 and 53 left. So 51 and 53 have multiple procedures, and we have a discontinued procedure, one that didn't even continue on or remain completed. So therefore, the multiple procedures, this has the next highest reimbursement because this procedure was completed and it was multiple procedures during the same operation. Okay, so therefore, this will definitely get the next ranking in reimbursement levels. Okay, so now we have, last but not least, 53, and so we know that's going to be the last one. Why? Because it clearly states here it's discontinued. Again, the procedure, they couldn't continue with any unforeseen circumstances, like the patient going into shock, can't finish it. So therefore, this would be the last reimbursement, okay, service. Okay, and it wasn't a procedure because they couldn't perform, they couldn't finish the procedure. So discontinued. So this is how you would rank it. Okay, and then now you have to explain your rationale. So I'm going to leave you to do that. Explain your rationale. Just pretty much point out, that these separate procedures, are at a greater level or value. Okay, then multiple procedures done, okay, on the same patient, same day. And then discontinued services, time spent was little to none. Okay, so just explain your rationale in your own words. That's what I'm looking for. So be sure, again, for full points, be sure to